Hi everybody, it's Beth. I'm back with the next part of the hip muscle series. I'm taking this from my Thigh textbook from last semester, and we're going to be going over the adductors here. I've got a lovely picture on page 427. I'm going to break it down and show them to you one by one. And the beauty about it is when we're getting to this part of the body, there are some commonalities in the different muscle compartments. So what we've got here, we're in the adductor region. So if we think about what adduction is, or adduction, we're going to be bringing the lower extremity towards midline. So to do that, the logical place for the stuff that we're going to be talking about to be inserting is going to be on the medial side here of the femur. So to start with, I'm going to talk a little bit about the obturator externus. We have the obturator foramen here. We've got an obturator externus and internus. The internus starts on the inside. The externus starts on the outside. I'm going to go over the internus later. But for now, we're going to start with the externus. It's coming from out here. And it's coming around to the trochanteric fossa. So right behind here, that little dimple at the greater trochanter. So it's coming from the outside edge here back to the trochanteric fossa. So when it comes in, that helps you adduct. The other adductors usually are a little easier because they say adductor in the name. So the primary adductor here, we have the adductor longus, and that's coming from the superior pubic ramus and coming on down along the back side toward the medial side of the linea aspera. We also have the pectineus, which is coming from the pecten pubis here, this central part. It's going to the linea aspera as well at the back. We have the adductor brevis, which you can distinguish from the longus by its origin here at the inferior ramus, and they're all coming back here towards the linea aspera on the posterior side of the femur. Then we have the adductor magnus that's coming from inferior pubic ramus and the ischial tuberosity back here. It's coming from both areas, here and here, and it's got two parts that it comes in at. It comes in down farther on the femur than the rest, and it's also coming in partly up a little higher on the medial side of the linea aspera. We also have a little adductor minimus that comes from the inferior pubic ramus here and goes to the medial lip of the linea aspera. And according to this textbook, it says that the minimus can also be called part of the adductor magnus. So one of the things that these all have in common, aside from the action of adduction, is the nerve supply. And that's a little easy to remember because of the landmark. We've got the obturator foramen right here, and they're all connected by the obturator nerve. They're all innervated by the obturator nerve. Now there are two in this list that have dual innervation, so it's obturator and. The two that have the dual innervation are the adductor magnus and the pectineus. The pectineus, because it's coming from up farther, that's closer to the hip flexors, which are femoral nerves. So the pectineus is obturator and femoral nerves. The adductor magnus, which is coming down lower, almost closer to the there's like right next to the hamstrings, to some of them down here. So that's got the two innervation of obturator and the tibial nerve. So that's part of same innervation of the hamstrings for part of it. But the adductors are all clustered in this area. One of the other ones that helps adduct here is the gracilis, we talked about that when we went over some of the knee muscles because it's the two joint, and that one comes from along here and goes down and joins with the others at the pes anserine. But this is very briefly the adductor muscles at the hip.